Hello and welcome to this edition of the Time with Hime podcast. I'm your host, Lynn Cordes, joined by our superintendent, Mr. Hime. Welcome back, another week.
Great to be here, another week. It's kind of amazing. We're in the middle of June.
It's going fast.
Summer always seems to go too fast, but a lot of exciting things going on at LPS, and we're getting ready for a 21-22 school year, and hopefully we're way more normal this year than we were last year. So we're kind of getting excited. We're having some really great meetings, and summer school is going great. So
we have a lot of great photos on our social feeds, too. So if you guys want to check it out and see what's going on in the classroom with our kiddos, be sure to check our feeds out. We have somebody exciting here today. We kind of started.
A friend of LPS.
That's
She's
right.
Our award winner this year. Very exciting. Even today in our meeting, we were talking about getting through the year and great things, and one of the topics was the health department and Brandie.
That's
and all
right.
the great things and that partnership we had through the year, and that we started school the first day and had school all year with very little hiccups, and a lot of that was a testament to the health department and how we worked with them. So we're excited to have you with us today.
Hi, Brandie. How are you?
I'm well. Thank you for having me.
So I guess to start with, you can give us an update on what does COVID look like? We watch the TV. What are the numbers? What does it look like in Comanche County, Lawton in particular, in your area? Because you control all of Southwest. You are the director of all of Southwest Oklahoma, like 9 counties. So how's it look right now?
So when you start talking about cases, our cases are looking pretty good. So I see about, I get a report every day about how many positive cases that are coming in. And in our district, we have anywhere from 30 to, recently we bumped up to 100 a day. But that's because if there was an isolated outbreak that we're, again, completely familiar with where it is and it's contained. So cases looking great. Vaccination rates, very concerning. You hear all the time, early on in our vaccination efforts, we were getting a lot of accolades. Oklahoma was leading the nation on getting vaccines out, and then all of a sudden we've dropped to the bottom. So we dropped to the bottom because we did a good job of getting the vaccine out. When it was available, we were out there. The 65 and older population, they wanted it. They waited in lines, and then everybody that wanted the vaccine, that was anxious to get the vaccine, they got it. They got it in a timely and efficient manner. And now we're trying to reach those that are hesitant and those who aren't sure if they want to get the vaccine. And we've seen things come, unfortunately, comparatively speaking, to a screeching halt. So we want more people to get the vaccine. So in Comanche County, we have about 29% of our 12-year-olds and above who are fully vaccinated. And so, again, I say 12-year-old because that's who's eligible. Anyone over the age of 12 and over can get vaccinated. Under 12 can't. And then when we go to our 65 and older population, we have about 62% that are fully vaccinated. And when you look across the state and even across the country, that's not up to par.
So I guess from my seat, the fear is I very much respect a parent's right to choose whether their kids are vaccinated or not. But our ultimate goal is to get back to normal as much as we can. And not wearing masks is getting back to normal. Yeah. But if we go to school and 10% of our students that can be vaccinated are vaccinated, although we may not require masks, we're any day away from having some major issues. So can you explain, again, it's a choice, what are the advantages for a 12-year-old, a 15-year-old, an 18, why should they be vaccinated? Some people say, well, they're young, they're not going to get it. 18-year-olds aren't dying anyway. 18-year-olds aren't going to the hospital. What are their advantages as far as getting back to normal if they are vaccinated?
So if I were speaking to a 12-year-old or even to a coach or to a parent, I would say the biggest benefit is we're not going to have to quarantine a fully vaccinated individual. So if they are a contact to a positive case, you'll recall last year we had to do seating charts, and we're still going to be doing some of that, but seating charts, or if you were part of a team, an athletic team, and somebody on the team was positive, everybody was quarantined because we couldn't distinguish between whether or not they played 2 minutes on the court or if they were where they were in the bus and all of that. So a fully vaccinated child, that conversation is off the table. So we're not going to quarantine. It's different if a fully vaccinated individual tests positive, they're still going to have to isolate. But so to a 12-year-old, to a student, to a coach, and hopefully to a parent, that matters. From a public health perspective, a healthcare system perspective, our physicians and our nurses that are working in the hospital, we think it's very important for people. I mean, the quarantine, yes, that's a benefit, but we need a community vaccinated. We need that community protection so that we don't see those pockets of outbreaks. where we end up losing lives. So yes, 12 and 13-year-olds weren't the ones who were, in the hospital on a respirator losing their life, but they're certainly the ones that are passing it along to others who very well could have a detrimental health impact.
So let me put this in, from my thought. I'm vaccinated. If I get the flu, you really would expect me to quarantine and stay away from people because I have the flu until I'm 24 hours past symptoms. Mm-hmm. So what's the difference for me now if I get the COVID, you want me to quarantine until my symptoms are gone, 24 hours, and I can go back to normal, or is it a little longer?
Are we saying quarantine or isolate?
Isolate, I'm sorry.
Okay, I got you.
You got me.
I got
You're
you.
not supposed to do that.
You remember. That's what you got me for. Make sure we're good.
Explain the difference in how much closer a vaccinated person is to really normal. We used to come to work sick, and we're really encouraging people, don't come to work with the flu, don't come to the work with strep, don't come to work with the stomach virus. The expectations and what truly from a health is a difference.
So, you make a good point. So we're still going to ask you to isolate. If you test positive, we're going to ask you to isolate. And that number is subjective based on symptoms and based on test date. So that all looks different. So it's not going to be just the 24 hours and then you're
okay.
fever-free and you get to come back, unless CDC changes something. But right now, as it stands, it's still that 14-day quarantine period based on either symptoms or test date. So the important piece to that is when we talk flu and COVID, we saw last year it's two very, very, very different things. And the impact in our communities are vastly different. We lost a lot of Comanche County residents, too many Comanche County residents due to COVID. So because our vaccination rates are so low and because the health impact of COVID can be so detrimental, we need to make sure that we're still being very diligent in our efforts to contain anyone who's positive, to contain any possible outbreaks, and then certainly continue to push and promote COVID vaccinations. That really is going to be our key to getting back to this normal. Isn't it great to sit here without having a mask on because we're all fully vaccinated? That's not going to necessarily be the case because you're going to have kiddos in classrooms because, again, I just told you 29% of 12-year-olds and up in Comanche County are vaccinated. That means 30 or 70% are not. So you're going to have a huge cohort of kiddos that are in your classroom that are not vaccinated that may end up being quarantined because of cases.
Now, have you been aware of because of the mask mandate, it's kind of the state legislator, as they do some great things sometimes, and sometimes you're wondering, what are they thinking? They took that out of my hands for me declaring a mandate. But what people don't realize is guess who gets to declare it now? If you read that law, you can pick up the phone and say, Mr. Hime, it doesn't take board action anymore. You can say, Mr. Hime, you've got an outbreak. It's starting to break out. You need to start requiring your kids to wear a mask. And even those that are vaccinated would still be exempt from it, so to speak. Is that kind of how that's going to work? I mean, CDC could change tomorrow. We know that.
Yeah, so we're still working on the guidance for schools specifically. I sent an email when I found out that I was going to come and speak. It's the opportunity to speak with you to find out exactly what we're doing in Oklahoma, and we just don't have it completely ironed out yet. Waiting on CDC to provide that guidance.
It'll change again.
You lived through last year, and you know that that's the truth.
Yes.
At the end of the day, we're trying to do what's best to protect our populations and to protect the most vulnerable and to prevent outbreaks. And again, if we just reflect back, we can't forget what we went through last year, and we can't forget the overwhelming burden it was on our healthcare systems and on our nurses and hospitals and frankly our funeral homes and things like that. And so it just had such a detrimental impact. We have to respect the fact that this virus is dangerous, and we have to make sure that we're being very aware and responsible in our actions. But I am among everybody else who loves the fact that I can walk around fully vaccinated and not have to wear a mask everywhere I go.
Well, and the other thing I think became a misconception because we live in this instant news world and Twitter and Facebook and our news channels now, is I didn't wear a mask for me. I wore it to protect the people around me. Yep. And I think at vaccinations, do you feel the same way? Did I get vaccinated to protect me? Yes, but my vaccination also protects those around me. And I think that's something that we really got to preach, that, you getting vaccinated is protecting your family and the people around you.
And that's exactly right. We were just talking about this back whenever we had polio and measles. No one was asked, do you want to take a vaccine? It was, this is what you have to do to protect yourself, but even more importantly, truthfully, to protect the population. And so we don't live in that time now, and we have the glorious benefit of social media, and we have people who argue with physicians and scientists and researchers and public health professionals and feel like that because they heard something that becomes the gospel as opposed to what we know from science. And so that just always puts a different spin on things and a different challenge whenever we're trying to get positive messages and messages out to protect the community, which vaccinations protect the community.
Obviously, if everybody in Comanche County got a vaccination, we would be normal. And people don't understand. I read somewhere in all this that the measles vaccination, although we've eradicated the disease, is only 90% effective. But because everybody got the vaccination, 90% is enough to eradicate the disease. All the COVID vaccines of the three are all 90% and above effective. So if we required everybody to get one, which that's not what I'm advocating. And again, I want parents to choose. We have people we know that have allergies. They need to talk to their physician. But those of us that are healthy, we think, well, I'm healthy, I don't need a vaccine. If you can get one, getting one, again, protects people around you. I'm going to be curious to see in athletic events, coaches, how many of our athletes get across the state, nation. If you're a college football coach, would you want all your players vaccinated?
Right. Well, you would think, and fans would think that they would want them vaccinated as well.
You don't think the Buccaneers want to lose Tom Brady for a couple weeks because he's not vaccinated?
Right.
So.
Well, and that's a good point. Just staying in contact with your physician and making sure that you know all the facts and you can make the best decision for your family and for yourself. And that also leads to the fact that you are giving the clinics around, and we're still doing that with the school district.
Yes.
And so you'll be in August as well, correct?
Yes, we're going to be doing back to school events. We have a mobile unit. If you've driven by the health department, we have a nice mobile unit. And so we've been out. We have literally, our nurses have worked their little tails off. They are sitting in parking lots. They have gone out to schools. They're willing to go anywhere to provide that vaccine. And I keep saying it, we're at the point where we are wanting people to have to kind of trip over us and say no instead of hunt us down to say, yes, I want the vaccine, because we know that we've already hit that population. Those who were ready to get it and anxious to get it, they got it. But, we're to a point where it's not about access. They can access the vaccine at local pharmacies, physicians, the health department, 5 days a week, 8 to 5. We're at farmers market. We're out on the weekends offering it. We're going to be at the back to school events offering it. It really is about making that decision to say yes. And we want people to be educated. We want them to be confident in why they're getting the vaccine. And so we're trying to also do a very good job of putting accurate and reliable and consistent information out about the vaccine so that they can make those choices.
So let's get this clear. So a student, middle school, 14-year-old, they can only take what vaccines are available for them?
Pfizer.
Just the Pfizer. Mm-hmm. And the Pfizer is...
That's the vaccine that you have to take. There's a 3-week interval. It's 2 shots. It's not the Johnson & Johnson, which is the 1 dose, and we all recognize that's the preferred as far as just 1 shot.
And it could possibly be available by the time school starts. But,
they're doing research, yeah.
But the Pfizer, so if you got your first shot today, how long before you're fully vaccinated?
Okay, so you have to get your first shot today. In 3 weeks, you can get your second shot, and then 2 weeks later, you're considered fully vaccinated.
So we're talking about 5 weeks. Mm-hmm. So that's what parents need to understand. If they have student athletes or when students start school, they want to make sure they don't get those disruptions. They need to go today because it's going to be a 5-week interval. So they need to get that started as soon as possible because they're going to be subject to quarantines basically all of August and most of September, even if they get it at the back to school event.
Right. Now I appreciate you bringing that up because you're right. That's a very good point that there is a 2-week after your second dose, regardless of what dose it is, and that's for adults or children.
So if I'm a football player, I could be halfway through football and I'm subject to quarantine. So if your team's not vaccinated, a player gets it, we're not wearing masks, we're not social distancing like we did this year, that net's going to get wider.
Right.
They got to understand we went to 3 feet, but that was with the mask and social distance.
Yes.
Yeah, with the mask and other factors.
Yeah. And, a lot of schools and a lot of everybody, we're all so tired of talking about COVID and we want to talk about something else and we don't want COVID to restrict us any longer. But the fact of the matter is, if we start seeing outbreaks, we have to be responsible. We have to be diligent. We cannot allow outbreaks to occur in our communities. People will be isolated. We will be asking people to isolate if they test positive. We will be asking school administration to quarantine. So the seating charts and all of those things that we did last year are still going to have to be a factor this coming year. We just hope we don't have to utilize them quite as often.
That extent that we did last year.
I guess my ultimate dream is as many people as possible that will get vaccinated, because the more that get vaccinated, the closer we get back to normal.
Yep.
That's right. And for more information for our families, if you're looking for that, you can always check the Comanche County Health Department's Facebook page, and there's some stuff online as well. Brandie, thank you so much for joining us. We always appreciate you coming and sharing some information with our families and with us, and that, keeps everybody...
Yeah. And again, a huge shout out to Brandie and her team at the Comanche County Health Department for how well they've worked with the school this year and how they've made it possible for us. I think we were the largest school to be in-person learning all year from day one to the end. I don't think any school, most of the schools went A-B schedule and they missed a lot of time. They waited and we were in school from beginning to end, minus the ice storm.
Right.
But the cold weather. So a great shout out to you guys, because you deserve a lot of the credit. What else we got this week?
Well, thank you so much again. And there's a lot of great things. We also heard from our Ike Ignition students that they received first place for the Lead for Change, and they got $10,000 for their organization of choice, which was Family Promise. So we're really excited to
Awesome.
do that with them and share that out. And now let's talk about something that we just pushed out this week that,
Always confusing.
it is, because it's different. And
Yes.
this year it's different, and that is our school supply list. So can you share with our families why it looks the way it does?
One of the challenges you always have when somebody looks at it with a different set of eyes, and so you bring in new people, new administrators, we look at the school supply list, and it's like, you sat down with your administrative leaders and your team and said, do we need all of this stuff? Do we really need that on the supply list? I mean, parents, they don't need to buy things we're not going to use. So we trim that down. How many of these things on there should the school actually be buying that aren't on the list? We're not going to expect our teachers to buy anything. We're going to get what our students need, and that's a big thing we're pushing out there now. And so you hear me say this all the time. It's my job to provide the resources. I think that's the most important thing a superintendent does, is provide the staff, teachers, principals, and students with the resources they need to get a quality education. So this is just to help our parents. I mean, there's nothing worse than a parent having 3 kids. I had 3 kids. You go get school supplies and buy a couple outfits, and you spend $1,000.
Right.
And how do we make that a better situation for our parents? And they bought 14 glue sticks, and they come home at the end of the year with 8 of them. And I'm not saying that happens here. I'm just saying let's make sure that we don't have a ream of paper on the school supply list. Just between you and I, we looked at one where we trimmed off a flash drive. Well, all of our kids have devices, and not one of the devices we check out of our kid has a place to plug this flash drive in. So what does a student need with a flash drive? So we have Google, so we all have the cloud. We got Drive. So it's just some things as we advance, things we used in the past that we don't need anymore. We're just trying to make it better.
And the other thing that's different is that it's a standardized list for elementary. Each elementary does not have their own list like they did prior. And then we are working on the middle school, so we have not pushed that one out. But elementary is on our website and on our social feeds.
And that's even some of our teachers are used to having some specific things they want. But what our challenge if it's something they really need, we'll get it for them as a district.
They'll go through the building and get taken care of.
Our expectations aren't that our teachers buy anything or purchase for their students. Our expectations is we lessen the burden on our parents and create more opportunity for our students.
That's right. Okay, let's talk about transportation. We just did a news story out there with our local media looking for bus drivers, but we're also working on bus workshops too. So staff can come in, and if they want to do activity bus driving, right?
Yes, we're always looking for bus drivers. It's one of those. It's a great job, but it's one of those tough positions to find because you work a couple hours in the morning and a couple hours in the afternoon. So we are looking for bus drivers. If you're interested, you can obviously go onto our school website and bear with us a little bit because we're changing websites. Give the website team, but they should have it up and running now. By now, that should be back up and running. But again, get online, apply to be a bus driver. We're always looking for bus drivers.
And speaking of our website, we are transitioning. So July 1st, you'll see a new look. But if you can't find something on the website, Mr. Hime, tell them where they can go.
info at LawtonPS.org. Again, we're always looking for questions. That's the one thing we're not getting. I guess I'm not going to say we're not getting enough, but we'd like more questions to give us some topics to discuss. And hey, you hear this all the time, podcast video. If you got anybody you would like us to bring on as a guest, please bring them. We're excited to get our guests. And again, we started this a few weeks ago, and it's really gone over well because we get more people than just me and you talking, and we're trying.
I'm sure they love that.
Yeah, we're trying to provide information to our parents and our students and our staff, and even our community in some ways. So we're excited about that.
And thank you to our families that have emailed us. We do get them, and we appreciate the input. And thank you, Mr. Hime, for joining us this week. I know we went a little long, so I don't want to keep our families any longer. We appreciate Brandie coming in and
thank you very much. Anytime, and we may bring her back at the first of the year when we talk about the vaccine, so parents know the entry or such, and we'll revisit exactly how you can get the vaccines in August. But again, I encourage if you're an athlete or you're really concerned with quarantines of your students, that you get in line, get with your doctor, or get to the health department and get your vaccines early.
Correct. And until next week, you guys, thank you, Mr. Hime, for joining us. Brandie, thank you for joining us. And you guys enjoy this weather. It is going to be a hot one, so remember to stay hydrated and keep the pets and kids out of the cars because it is so hot. Don't leave them in there.
Just Oklahoma,
it's crazy.
2 weeks ago, we wondered if we were ever going to get to use our pool, and today we can't use it because it's too hot.
That's right. Well, I hope you get to use it soon because that would be a waste.
There you go.
It would be a waste this summer. You guys have a wonderful weekend. And until next week, we will see you then. Have a safe and wonderful weekend. And I think that's all we have for them.
Yep. Thank you.
Okay.
Till next week.
Bye-bye.